Good afternoon, everyone. It's Dr. Hart again. I am going to just go through a few NCLEX style questions in this topic of eating disorders. Okay, so let's get started. Let me take this minute to hope that you're enjoying the videos that I've created so far. I'm trying to cover the lecture on the topic, and then the next time I will do a couple of test questions, practice questions on that topic. So I covered eating disorders previously, and if you remember, if you happen to watch it, there are three main types of eating disorders. There is anorexia nervosa, bulimia nervosa, and binge eating disorder. And there are different things going on with each one, specifically the things you should know are anorexia, the person is under eating to the point of sometimes of starvation. These patients are deathly afraid of gaining weight, so they are restricting their intake, calorie intake, sometimes to the point of severity, and the person that needs to be hospitalized. BMI, I talked about normal range BMI 18 to 24. Patients with anorexia can have a BMI as low as 17, even 15, and that when that happens, that is the point where hospitalization may be required. The next type of anorexia I spoke about was bulimia. Bulimia is a different type where the patient is ingesting large amounts of food in a compulsive behavior. After consuming those large amounts of food, they begin to purge, where they will induce vomiting, usually by putting their hand into the mouth. Sometimes the patients can even train themselves to vomit without doing that, without putting the hand down the throat to elicit the gag reflex and causing the vomiting. Because of that vomiting, the vomitus in the stomach is very acidic, and that vomitus in the stomach acidity is going to cause, as it's coming up, it can cause a burning esophagus, and it can also cause, as it's coming up, a tooth erosion, dental caries, which are cavities, foul mouth odor because of the bacteria built up in the mouth. Persons with bulimia are generally going to have a normal range, normal BMI, in the normal range. And that is because although anorexia patients are starving themselves, their BMI is going to be very low. The bulimia patients are going to have a more normal BMI because they are ingesting some calories before they have the chance to vomit the contents back up. Okay, so they're more in the normal range when it comes to weight. You're also going to see the vomiting I mentioned, tooth erosion, and also because they're putting their hand down the throat, you may see calluses on the dorsal part of the hand, and that is called Russell's sign. Russell's sign. In the textbook that I've read, it does say, though, that The Russell sign may not be as reliable because, again, the person may have trained themselves how to vomit without using the hand down the throat. The third type of eating disorder is binge eating disorder, and that is just huge amounts of ingestion of large amounts of food. And that binge eating disorder, the patient is not vomiting any ingested food. So they're just a continual weight gain, and it's usually emotional eating. You can refer to the show My 600-Pound Life. It covers patients who have binge eating disorder. They're not able to stop eating. They don't know how to stop. And they will continue to gain weight to the point where sometimes they have to be physically removed from the house. They're bedridden if they have to be physically removed from the house. Sometimes the paramedics or the firefighters have to actually remove part of the wall or the door in order to get the person out of the house. That's how large these patients can get. Okay, so let's start with these test questions. The first one is, the nurse is assessing a client newly admitted to the eating disorders unit. There are typically specialized treatment centers for eating disorders. Which findings indicate the client may have a diagnosis of bulimia nervosa? Select all that apply. So select all that apply. Just take each answer choice and ask yourself, is that true or is that false? And that's a good way to get in the habit of answering select all that apply. I know a lot of students struggle with those. And just try to take your time, consider the time you have to take the quiz or exam or the standardized testing, and watch. It's going to give you a timer. Watch your timer and consider the time you have, and use the time that you have to read the question multiple times. Read the answer choices. So here are the answer choices. Number one, now we're talking about bulimia nervosa. So you have to know the signs and symptoms of bulimia. Number one, BMI of 24. Number two, amenorrhea. Number three, erosion of tooth enamel. Number four, lanugo. And number five, Russell's sign. Okay, so I'll give you a minute to pause this and think about the answer, what you think the answer is. Select all that apply. It may only be one answer. It may be 2, 3, 4, or 5. All 5. That's what select all that apply is. Okay, so it may be up to 5 answers are correct. So I'll give you a minute and we'll come back. I'm going to take this opportunity to talk about my YouTube channel, Nursing with Hart PhD, and also I am on TikTok. I think it's my name on TikTok is Susie Q. So take a look on there for more content and practice questions. If you're enjoying the videos, get something out of it, please like and subscribe on the YouTube channel. Okay, we're back. And so the correct answer on this one, okay, is the first correct answer is number one, BMI of 24. I mentioned normal range BMI is 18 to 24. That's normal range. BMI can be lower or it can be higher. So a person with bulimia, they're going to have a BMI closer to normal, so you have to know normal range for BMI, 18 to 24. The person with bulimia I mentioned is going to have a more closer to normal BMI because they are ingesting some calories, some fats and carbohydrates before they have a chance to vomit, vomiting. Number 2, amenorrhea. That is not correct. That is the sign for anorexia. Okay, person with anorexia is going to lose so much body fat that their menstrual cycle will stop. Number 3, erosion of tooth enamel is correct because a person with bulimia is self-vomiting, and I talked about when they self-vomit, the vomitus comes up, erodes, can damage the esophagus and also damage the tooth enamel. Okay. Number 4 is lanugo. Lanugo is a sign of anorexia, not bulimia, so that's incorrect. Lanugo is a baby fine hair that grows on a person who is anorexic. And number 5, Russell sign is correct. That is a sign of bulimia. The Russell sign are the calluses on the dorsal side of the hand from the person putting the hand down the throat in order to self-vomit, cause themselves to vomit. So the correct answers on this one are 1, 3, and 5. Okay. 1, the normal BMI of 24. Number 3, erosion of tooth enamel. The gastric acid in the vomitus contributes to the erosion of tooth enamel among individuals with bulimia. And then number 5 is also correct, Russell sign. Russell sign is an indicator of purging and is characterized by calluses on the dorsal surface of the hands, typically the knuckles. And so why do you think the calluses form on the dorsal side of the hand? Think of the hand going into the mouth. What's hitting this right here when you're putting your hand in your mouth? Your teeth. Your teeth are going to continuously hit the dorsal side of the hand, and that's going to cause the calluses. All right, next one. While assessing a client diagnosed with bulimia nervosa, the nurse observes, and I even put some of this in bold, the nurse observes multiple cavities, enamel erosion, and tooth sensitivity. Which best explains the nurse's findings? Okay. Okay, so number 1 choice, electrolyte imbalances. Number 2, self-induced vomiting. Number 3, nutritional deficits. And number 4 is dehydration. Okay, so I'll give you a minute and we'll come back and talk about the correct answer. Okay, we're back. So again, we're talking about bulimia. This is the person who is binging and purging. They're binging on large amounts of food, and then they're causing themselves to vomit the food back up. Okay? So number 2 is the correct answer. Self-induced vomiting is best explains the nurse's findings. And then if you find this in your patient, you can report this to the physician who may put in a referral for a psychiatry visit for the patient. Okay? All right, so let's go over why the other answers are not correct. Number 1, electrolyte imbalances. That doesn't have anything to do with the cavities, enamel erosion, tooth sensitivity. Patient with bulimia may have electrolyte imbalances because of the loss of the vomitus and the nutrition and the electrolytes in the stomach, but that's not the reason for cavities, enamel erosion, and tooth sensitivity. Number 3 is nutritional deficits. They may have nutritional deficits with bulimia, but again, this is not the reason why they have cavities, enamel erosion, and tooth sensitivity. And the last one, dehydration. Same thing. The patient with bulimia may have dehydration because when they induce vomiting, they're losing the fluids in the stomach along with the stomach contents, which may cause dehydration. So those other answer choices are kind of tricky. You have to read the stem of the question very carefully and then the answer choices to come up with the correct one. Okay, last one. Which is the priority nursing intervention when caring for a client diagnosed with an eating disorder? Okay, key words are priority nursing intervention. All right, I'll give you a minute. Let's read over the answer choices. Number 1, accompanying the client to the bathroom. Number 2, remain with the client at least 1 hour after meals. Number 3, encourage the client to keep a diary of food intake. And number 4, discuss feelings of emotions associated with eating. All right, and I'll give you a minute and we'll come back and talk about this one. Okay, let's come back and talk about this last question. Okay, so which is the priority nursing intervention when caring for a client diagnosed with an eating disorder? Okay, and the correct answer is number 2. And I talked about this in my lecture about eating disorders. These are called meal observations, remaining with the client at least 1 hour after meals. These are meal ops or meal observations. These are ordered by the doctor. And this is where a tech or a nurse will stay with the client. This meal observation is because the client may use this time after eating to discard food that has been stashed from the food tray or engage in self-induced vomiting. Okay, let's go over the other answer choices. Number 1, that are incorrect, accompany the client to the bathroom. So with a client with an eating disorder, you're not going to accompany them to the bathroom every time they go. Okay. Number 3, encourage the client to keep a diary of food intake. Okay, they may at some point, once they get into the therapy, keep a diary. The nurse or the therapist may ask that they do that. Number 4, but that's not the priority. Number 4, discuss feelings and emotions associated with eating. Again, they may do this during therapy, but it's not the priority. Okay, the priority is to remain, of these 4 answer choices, to remain with the client for at least an hour after meals. Okay, and that's it for now on eating disorders. I hope you enjoyed it, and I'll see you soon. Have a great day.